Hello again, student nurses. So for today's episode, we are going to discuss the antibiotic piperacillin sodium and tazobactam sodium. It is an extended spectrum penicillin. It has a brand names of tazoxin and zocin. It is indicated for the treatment of appendicitis, which is complicated by rupture and abscess, peritonitis, uncomplicated skin-to-skin structure infections, including cellulitis, cutaneous abscess, and ischemic or diabetic foot infections, postpartum endometriitis, pelvic inflammatory disease, community-acquired pneumonia with moderate severity only, and moderate to severe nosocomial pneumonia. And as part of its extended spectrum, its activity includes beta-lactamase-producing strains of S. aureus and H. influenza bacteroides. Before digging into the important part, let us take a sneak peek of their mechanisms of action. For piperacillin, it is a bactericidal wherein it inhibits cell wall synthesis by binding to bacterial cell membranes. And for tazobactam, it inactivates bacterial beta-lactamase, and also it protects piperacillin from enzymatic degradation, extending its spectrum of activity and preventing bacterial overgrowth. It is rapidly and almost completely absorbed within the first hour after IM administration, with 16 to 22% protein binding and crossing the placental barrier. It has no significant metabolism and has 42 to 90% of it excreted in urine by renal, tubular secretion, and glomerular filtration, also excreted in bile and breast milk. Now, student nurses, to ensure patient safety, here are the must-to-know informations. Piperacillin sodium and tazobactam sodium are contraindicated to patients with hypersensitivity to any penicillin, and used with caution to patients with history of allergies, especially to cephalosporins, patients with renal impairment, and pre-existing seizure disorder. Now, let's go to the normal side effects of piperacillin sodium and tazobactam sodium, and there is no need to report to the doctor for these symptoms. For frequent use, diarrhea, headache, constipation, nausea, insomnia, and rash. And for occasional use is vomiting, dyspepsia that is manifested by heartburn, indigestion, and epigastric pain. And also, pruritus, fever, agitation, candidiasis, and dizziness.
For the need to report symptoms or the adverse effects are antibiotic-associated colitis, other superinfections with the manifestations of abdominal cramps, severe watery diarrhea, and fever. Overdose, more often caused by renal impairment that may lead to seizures, neurologic reactions. And lastly, severe hypersensitivity reactions, including anaphylaxis that could occur but rarely. And the last but definitely not the least are the nursing responsibilities before, during, and after administration of piperacillin sodium and tazobactam sodium. First, ask patient for history of allergies to any penicillin and allergies to cephalosporins, history of renal impairment and seizures, and pregnancy or lactation. Although this drug is pregnancy category B, caution is still required if administered to a pregnant woman. Next is conduct physical assessment to gather baseline data. And lastly, teach patient of the normal side effects and need to report symptoms. During administration, a nurse should observe the rites of administration. And lastly, after administration, document the data and monitor and evaluate patient for adverse effects. That's it for piperacillin sodium and tazobactam sodium. I hope you learned something. See you in our next episodes. Bye!